Hello, my name is Laura Lopez and I am with the TTU Ethics Center. And today we are interviewing Theresa Byrd. And I'll let you go ahead and introduce yourself.
Okay, thanks. My name is Theresa Byrd, and I am the chair of the Department of Public Health and also Associate Dean for the Graduate School at Texas Tech University Health Sciences Center. I came out here about 7 years ago to start the public health program here.
Awesome, thank you. Let me start with our first question. How does the Code of Ethics play a role in your discipline?
Well, public health does have a code of ethics, and it has about 12 parts to it, so I printed it off because I can't remember all of them. But it's very similar to the code of ethics that one would find in medicine, except for that it's for a whole population. So, when we talk about confidentiality, we are not just talking about confidentiality for an individual, but also for an entire population. So if we're working with a population, we have to be careful not to publish anything or say anything that might hurt that population. So it's kind of a bigger picture with public health because we're population-based rather than individual-based. And the most important thing for us is that we are trying to address sort of the health of populations, and whatever we do, it's in order to make it possible for people to be healthy. That's really our role. Our role is prevention, and right now in this epidemic, managing the epidemic, trying to figure out what's going on and making sure that we can keep people as healthy as possible.
Right. Okay. How may an ethics center be of value to the learning community?
Well, I think an ethics center is really important because every profession pretty much has a code of ethics, and we all learn about our own code of ethics. But I think it's really interesting to hear what other professions have. For instance, architects. I don't really know what their code of ethics is, but it would be interesting to know. I know they have one. And so I think it gives a learning community an opportunity to learn from each other and understand what other people's codes of ethics tell them. And it helps us to hold each other accountable as well.
Okay. What role may ethics have as the world transforms from crisis?
Well, as we transform from this crisis, which is going to take a while, it's not going to happen right away, but I think that ethics is going to play a big role in part, and especially in public health, in making sure that all of the services and benefits are equally distributed among the populations. Because one of the things that we're very interested in public health is, social equity, making sure that the most underserved and marginalized among us have the same opportunities as the rest of the population. So, we know that there are marginalized communities that are going to be hit harder by this virus than other communities. And so they're going to need more help in order to have an equitable sort of return to normal. And, in the United States, we haven't done a great job of that even in good times. I mean, equity is an issue always. It's an equity in healthcare. It's an equity in it's a problem in public health. So it's not something we are really good at. And I'm hoping that perhaps this particular crisis will get us, better suited to understand how to help each other rather than, harm the marginalized folks in our population.
Okay. What is the variation of level of care for those in rural versus urban areas?
Well, that's a huge issue because the rural areas, the hospitals in rural areas have been closing rapidly. I mean, there's a huge deficit. And so most people from rural areas are coming into the cities for especially, serious care when they have to be hospitalized. And also the remaining rural hospitals do not have the same equipment, the same money, resources that hospitals in a large urban center would have. So there's an inequity there, especially in rural communities. Now maybe the good thing about, I live in a rural community. I live in Robesville. So I'm surrounded by cotton fields. I don't have any neighbors.
So you
And I can see,
definitely are social distancing.
yeah, I'm social distancing big time. I can see the stars at night, you know. And you would think that people in rural communities might be less, you know, prone to getting this virus because of our natural social distancing. Unfortunately, I'm not sure everybody's actually doing that. I still see people drive into town, you know, go into Walmart and stuff. So, you know, we're not quite as healthy as everybody thinks we are in rural areas. Also, rural areas have higher rates of obesity, lack of physical activity, smoking, et cetera, all of those things that make people more prone to disease. So there's the good things and bad things about being in a rural community, but as far as service and even public health services, there's not as many in a rural community as there are in the city.
Okay.
So problem.
What are the challenges of COVID-19 in rural versus urban areas?
Well, I think, you know, some of the challenges are getting the information to people and making sure that they understand the need to social distance. You know, people don't necessarily, even in the cities, of course, people don't understand that. They, you know, and what we know about this virus is it spreads very easily. We also know that the current test has about a 30% false negative rate. So people can test negative and still be carrying the virus. And we also know that people can carry the virus and not even be sick.
Correct.
So that's why social distancing is important. And I'm not sure that message is getting out either to the rural community or the urban communities. But really the biggest issue for us in the rural communities is distance to treatment. Here in Roseville, it's not so bad because I'm 10 minutes from Lubbock. But for people who live out in the more distant rural areas, it's hard for them to get in to the cities for care. And with the closure of a lot of rural hospitals because they just can't support themselves, that's been a major problem. So it's a big issue.
How has COVID-19 affected your previous work life?
My previous work life. Well, I'm working from home, and I don't go out at all. In fact, I was supposed to get an allergy shot tomorrow, and they called me to confirm my appointment. And I called and I said, "Are you seeing sick people too?" And they said, "Yes." And I said, "I'm not coming for my shot." I'm trying very hard. I'm over 60, so I'm trying really hard to you know, stay as safe as possible and keep everybody else safe. Working from home has been a challenge because I live here by myself with a bunch of dogs and cats, and you know, it gets a little bit lonely sometimes. But really, we did a lot of our work online anyway. We have online students, so our courses just all automatically went to online. So it hasn't changed work much. It's changed the location more than the substance of my work.
How have your students reported being able to make that transition from classroom to online?
Well, about half of our students were already online, and so we just moved our in-person students over to the online, and they seem to be handling that fine. We had a little town hall with our students a couple of days, like last week, I think it was on Thursday or Friday, and they're coping fairly well, although for many of them, it's been very difficult. A lot of them are not working. And some of them are frontline healthcare providers. And so that is a very scary thing right now because the frontline providers get sick probably more than the rest of us. And so I think there's a lot of stress out there. But as far as the classroom activities, I think they're okay. It's just
How do
being
you
alone.
think they're dealing with all that stress, especially those working frontline plus still trying to keep up with their coursework?
Well, you know, we try to help them as much as possible. So, you know, we have been very lenient about when things are due so that if people really can't get it done, you know, we're not going to fail them or anything. We're letting them have some extra time. The university itself has given students extra time who are graduating to finish courses. And we do have at TTUHSC, and I'm sure at TTU as well, there are they can call in to talk to a counselor. And so a lot of our students are doing both the group and individual counseling with someone on Zoom from our center. So I think they're coping fairly well. A lot of our students are older and have families. So, I think that some of them are struggling with having their kids at home all the time. That's trying to get work done. That's kind of hard. I see their kids in the Zoom meetings,
running through.
Yeah. So kids, dogs, and cats. That's what we see in the Zoom meeting.
That's definitely true.
Yeah.
For your students out at the Health Science Center, if they are having a hard time coping with the stress of, I guess, that we are all going through right now, what would you recommend for them, or who can they contact?
I recommend they go to, we have a web page that's in our HR department called the COVID-19 webpage, and it has all of the contact information for the counselors and the group meetings and the town halls. We're having a town hall with the whole institution twice a week that the president is leading, which those are very helpful. I also recommend to my students that they make sure to get some physical activity. You can still go outside and walk around. Getting some physical activity, eating healthy, getting enough sleep, all of that stuff that we always tell people. But in these times when we're under a lot of stress, it's really important to make sure that you're moving around and eating right, and giving yourself a little bit of leeway. I don't want people to feel like just because they're working from home, they should be the most productive they've ever been in their lives. Because no, you're not going to be, because we've got all that mental stuff going on. So I think giving yourself a little grace is important.
Definitely. I think that's true. And I definitely have even found myself snacking more than I probably should. So those are definitely great tips.
Yeah, actually, this has been healthier for me because I only have healthy food at home, but I used to eat out a lot. So I've actually lost weight, which is good because I'm just eating home cooked.
People can say that right now, but that's definitely good to hear.
I haven't stocked up on any snack foods. I just have healthy food, so I'm eating that.
That's great.
I think we're pretty blessed to have the technology that we have, and we can talk to each other and see each other. But I do think that it's going to be a life altering for many people, and I think that it's important to think about how you can alter your life in a positive way. I'm studying a new language while I'm here. I think that's I speak Spanish, but I'm studying Hebrew, which is a completely different language, and making my brain kind of work on other things besides worrying about, how many COVID cases there are. So I think, we can come out of this more grateful than we have been, and probably more helpful to other people than we have been. So, I think we need to look at the positives and deal with the bad stuff. I mean, obviously we have to deal with it, but we can also think about the good things.
And do you think that we will actually be at a point where we can get back to our previous lives, or do you think that there might be some type of change that will just happen from here forward that we may not ever go back to the way it was previously?
Well, I think we might go back to the way it was, but it's not going to happen as fast, I think, as some people would like. It's going to take time. And as Dr. Fauci, who is my hero, has said, until we have a vaccine, we're probably never, this is going to come back if it goes away at all. So I think, yes, we will get back to what we consider normal, hopefully a better normal than before. Because one of the things that we've seen during this event is that our Earth is actually healing a little bit. because we're not having as much of a carbon footprint as we usually do.
Right.
And hopefully when we come out on the other side, we'll remember that and we'll try to continue to not have such a huge carbon footprint. So that could be a positive thing. But until the vaccine is tested and shown to be working, I think, it's going to be a little hard to get back to normal. But we will. I mean, we got back to normal after 1918, and we'll do it again.
How long does it typically take to come up with a cure?
A vaccine. Well, vaccines, they can probably come up with the idea for it fairly quickly, but it does have to be tested for safety, and then it has to be tested for effectiveness. So it's usually 18 months to a couple of years, from the beginning. I have read that there is a vaccine that's ready to be tested for safety right now. So somebody's been working on this. And so I would say, maybe within a year and a half, we should have something. As far as treatments, there are a lot of things that are being tried right now, and one of them is using serum from people who have recovered. Mm-hmm. And we've done that before with other viral diseases, and so that's being tested in several places, and that might be helpful. And there are several drugs that are being looked at, some that are not probably going to be as successful as some people think they are, but there's some antivirals I think that people are looking at. So, the problem with medical research is that we can't just think something works and put it on the market, because that can cause disaster. We do have to test them, over time. So, but I think we'll have something. We'll have something in a year to a year and a half, I think.
So how do you think everyone will do between now and the 18 months that it takes to come up with a vaccine?
Well, that's hard to predict, and there are a lot of models that people have been working on to look at peak times. When will the curve flatten? The idea of flattening the curve is, instead of having a big peak, we would have a slower sort of thing, so that we have enough healthcare facilities to take care of people. Our peak here, it looks like, is going to be somewhere between April 27th and May 2nd, something like that. And then, once it kind of starts to die out, and hopefully some viruses do kind of become less prevalent in the summer. So we'll see. We don't know anything about this virus yet because it's brand new. But hopefully it'll kind of settle down, and we'll be able to be next to each other again sometime soon.
Hug the person next to you.
Yeah. So I think it's going to take longer than people think. That's what I would say. But it will eventually, we'll eventually reach the end of this, and the curve will start to flatten out and go down. It's already happening in New York.
Oh, that's great to hear.
In Italy,
they were hit hard.
They were hit very hard, and it's still bad, but they are seeing fewer cases now. So, they're kind of at the peak and on their way to getting more normal. So,
when you consider the number of cases that we have in Lubbock, where do you think that we fall in that range?
I don't know how many cases we have today. I think we're probably getting up around 200, maybe, something like that. And we've had maybe 6 deaths. We won't be as bad as New York, because we just don't have that many people.
Right.
But it'll be a percentage of our population that is affected, probably similar to New York. I think it's pretty similar everywhere. And some of those people will be very ill. And not all of them are going to be old people. I know people think that, but, a lot of young people have succumbed to this disease, especially if they have any other conditions. So, I know that young people feel invulnerable, but, and they may do better than some, but they can also give it to their grandma and their auntie and all those people. So I think helping people to understand why we're doing this is the most important thing. That they don't think we're just being mean, you know. We just don't want this spread, and we want to slow it down. So, and I think, you know, we're not doing great at that. I give us a C maybe, because I do still see people congregating in stores and stuff, and I think that's probably not very safe.
So
But
what
we're
are
getting
your
better.
so what are your best tips, um, I guess, that you would recommend right now?
Well, I would say wash your hands a lot.
And we've definitely heard that time and time again.
Yes, and that's so important because of, you know, droplet contamination on surfaces, et cetera. Dr. Fauci has said that he washes his hands about 100 times a day. So, you know, if you've been out somewhere, if you've touched surfaces that aren't your own surfaces, then you need to be washing your hands. The CDC has now said that people can wear cloth masks in public. That's really more to protect other people than to protect yourself, because it keeps droplets when you sneeze or cough from kind of landing on surfaces. Um, and you know, keeping a distance from people, even though I know that's really hard. But you know, don't go to your friend's house to play video games. You know, don't go out to a park and sit at a, you know, table all together and eat. I mean, that's just, it's sad, but that's really how we have to keep ourselves apart from each other. This virus does, you know, fly through the air. Apparently, people get it that way. So we just need to be more aware of that. And cleaning surfaces, I think, is important. You know, I know that at some of the grocery stores, they're sterilizing the carts before they give them to you, you know.
Mm-hmm.
So those kind of things are important. But for most of us, I think it's washing our hands, not touching our face as much as possible, and eating healthy and exercising so that our immune system's in good shape.
Well, those are all great tips. And I would like to thank you for taking your time out of your day to interview with us. And we will definitely be posting the TTUHSC information so that your students can go there to find the information if they need anything about counseling.
Okay, great. Thank you so much. It was fun.
Thank you.
Okay, take care.